Technology with homeopathy. We're a hardcore homeopathy company. But our goal is, how do we make homeopathy scientific? How do we make it technologically savvy? So these are some of the things we've done in the past. My father in 1982 started medical record keeping since then. And about 20 years ago, we developed our own software with a company called Datamatics, which is a very well-known company in India. And since then, we've been collecting all our cases. So if you go to any clinic across India, all patient cases are on the cloud, and सब patients के data हमारे पास है. We've been dispensing medicines in blister packs to make it easy for patients. We have an online clinic, a virtual clinic, so patients can take treatment from wherever they are. We have some technologies and tools in the hair space. We have some very interesting programs. Again, these weight loss programs and sugar control and the skin analyzer and the oxy-lung are all married with technology. So in the oxy-lung, we have a spirometer where the patient comes into the clinic. We do a reading of the spirometer. It's connected to the software. We can check the patient's before and after results through technology. So these are all the technological advancements that we've done. We launched AI Skin, I think this year in April, and this is a very good skin tool that we have launched. It is again AI based, so it can tell you what kind of ailments the patient has, which even as a doctor I can't see with the naked eye. So what I'm not able to see, the AI can tell me underneath the skin, these are the upcoming diseases that the patient already has, and this is the right protocol for treatment. So we launched this, is doing very well for our doctors and our patients. Since April 23, we've had about 3,000 patients take this treatment with a 94% success rate. We're now launching AI Hair Pro. I'm a trichologist, which is a specialist in hair from the London Trichology Society. I'm the first Indian to be elected as their president. So hair is a very important part for me, and really, it's one of my favorite subjects. I've studied in great detail, and to launch this technology again is something very exciting for me. I'm just going to share the launch video with you. So what we've basically done is we have developed this AI tool in collaboration with some South Korean scientists, and the South Korean technology has met the big data of Dr. Batras. As I mentioned, we have been using, we've been storing patient data for the last 30 years, and everything is saved on the cloud. So if a patient comes after 20 years, 15 years, 5 years back for his treatment, all the records are available. So we have a data of 1.5 million patients, which is 15 lakh patients. And we have married, because AI needs data. Without data, AI cannot learn, AI cannot help. Big data is very important. So we've used the big data that we have, married an AI technology on top of it to get the best results. So like I said, this has been developed with the Korean scientists along with our team. It's taken over 10 months to develop. We'll be giving you a live demo to show you what it is. This is the certificate from the company that's helped us develop it, saying that it's the first time in India. So, a little bit about the technology. I'm not the technical expert, but I can just share with you that we have used a CNN network to develop this, this model. It is a SaaS-based cloud model for now. We will be moving it onto our servers shortly. The model currently has a 93% accuracy. The type of AI is supervised machine learning. Like I mentioned earlier, we have used 3 decades of patient data to train this model. We have used an 80-20 rule to train this model. And as I understand it, 80% of the data has gone in training the model, and 20% data has been used to test the model. So that is the 80-20 development model. We have used 20 input features for hair to get this model right. So things like hair density, hair texture. We have used things like scalp, oiliness of scalp, dryness of scalp, redness of scalp. So we put 20 inputs to train this model. And like I said, it's going to help patients for accurate diagnosis and getting the most suitable treatment. This is a little video from the expert team in South Korea who helped us develop it, so we can play that for you. I hope you can understand it. It was difficult for me the first time.
From Thai corporation from South Korea, we are in the industry of making medical machines and devices to sell in one. With this new AI-based hair analysis machine, we have collaborated with Dr. Batras and co-developed it together. As for customization with their inbuilt software, which has a very extensive database, we are very excited to partner with Dr. Batras in building this, as it is a big innovation in the hair industry, which has never been done before. We need a lot of benefit for doctors and as well as the patients. We are proud to say that Dr. Batras is launching the device first time in India. We are wish them all of the best. Thank you.
That's the South Korean team that helped us develop this jointly. I'll just talk to you about the 4 components of this Hair AI Pro, and then we'll go into a demo, which is where you'll really see how it works. So the 4 components are the AI-based diagnostic tool, which you'll just see. The diagnostic tool helps the doctor to identify the patient's hair condition. It helps us to see different types of hair conditions so that we can do something called a differential diagnosis to identify what type of hair loss it is exactly. This tool has 4 different lights and 2 cameras and a 300 times magnification, so that you're able to, as a doctor, see the hair under the right light and under the right magnification to really see how the hair follicle is doing. The second is the AI-based predictive degeneration tool. This is a very interesting thing, again, that's been developed. Here we take the photo of the patient, which again we'll show you today. We take a photo of the patient, and by inputting the type of hair loss, you're able to see what will be the disease progression. So like I mentioned, one thing that AI does is it shows you progression of disease. So here you can take a photo of the patient and you'll be able to see with other patients with similar condition through the AI tool, how this patient the disease will progress over a 2-year period. So that's very interesting for a patient, so they can see their progression, how the normal progression of the disease would go, so that they can then take the right intervention. The third is really the best part, which is the AI-based recommendation engine. So why do you go to a doctor? You go to a doctor who has a reputation. You go to a doctor who has experience, right? Now, how does a doctor build experience? By number of cases. So you go to a senior doctor because they've seen more number of patients. Now, with this model, what happens is, no matter which doctor you go to in our team, we have a team of 350 doctors across our 200 clinics. Whichever doctor you go to, that doctor will take your case, will use this AI system and AI model and run an algorithm. And that algorithm, in about 10 to 15 seconds, will recommend the best treatment that has worked for cases like yours. So therefore, the entire experience of the company, the entire experience of 350 doctors over the last 30 years, that cumulative experience is huge, it's vast. And how can we mine the data from that cumulative experience is what this AI tool is doing. So for you as a patient, no matter which doctor you go to, which clinic of ours you go to, you will understand and the doctor will understand how your disease will progress, and the doctor will be recommended by the AI engine that given your type of hair loss, how can the treatment be personalized? And what is the best treatment across 1.5 million patients that has worked, thereby increasing our chances of getting better results. So that's a very, very interesting part. And of course, the last part is scientific monitoring. I really believe that today when you're treating chronic diseases, the engagement of a patient is very important, because the patient has to be kept engaged, the patient has to be kept motivated, and you should be able to show the patient scientifically how he is progressing. Until today it was only, chalo, aapke baal achhe dikh rahe, nahi achhe dikh rahe. So now with this model, you can actually measure scientifically how the hair density, how the hair count, how the hair parameters are improving. So this is why it's a really good tool. I will now request my colleague Dr. Vaishali, who heads our aesthetic division, to please come and give us a quick live demo, after which we can answer any questions that you may have. Thank you very much.
I'm heading the medical aesthetic division at Dr. Batras, and we will be doing the live demo of the hair and the scalp analysis, which is the first in India AI-based scalp and hair analysis device. and I'll take you through the process, and you will see that how in like a very less time you can do a very detailed analysis of the hair of the scalp and get to know बहुत सारी चीज़ें जो शायद एज अ डॉक्टर मैं नेकेड आई से नहीं देख पा रही थी. ठीक है. सो दिस इज द पावर पैक्ड हैंडहेल्ड डिवाइस दैट वी विल बी यूजिंग अलॉन्ग विद द सॉफ्टवेयर. अब ये डिवाइस की खासियत ये है कि ये दिखने में छोटा है ताकि इजी है, हैंडी है यूज़ करने के लिए, बट इसके अंदर बहुत फीचर्स हैं. जैसे कि इसके अंदर 2 कैमरास दिए हुए हैं. एक कैमरा जो मैग्नीफाइड इमेजेस लेता है और एक कैमरा जो पेशेंट की जो डैमेज हो गई है या ग्रेड जो हो गया है हेयर लॉस का उसकी इमेजेस लेता है. इस कैमरे के अंदर 4 लाइट्स दी हुई हैं जो मेडिकल ग्रेड लाइट्स हैं. नाउ दीज लाइट्स हैव डिफरेंट फंक्शंस. जैसे कुछ क्रॉस पोलराइज्ड लाइट है जो मुझे स्कैल्प की जो कंडीशन है वो बेहतर समझने में हेल्प करती हैं. वेदर देयर इज रेडनेस, इन्फ्लेमेशन, स्कैल्प की कोई कंडीशन है जो मैं डायग्नोज करना चाहती हूँ, दैट इट विल हेल्प मी. इसके अंदर इनबिल्ट है यूवी लाइट जो हम नॉर्मली ब्लू लाइट के नज़रिए से जानते हैं. इस लाइट की खासियत ये है कि स्कैल्प में जो डैंड्रफ दिखती है, वेदर इट इज़ अ सेबोरिक डर्मेटाइटिस, वेदर इट इज स्कैल्प सोराइसिस, उसकी जो डिफरेंशियल्स हैं वो मुझे इस पावर पैक डिवाइस से तुरंत मिल जाएगी. So earlier I had to use 2-3 different devices to come to a diagnosis of the patient. This is all done with one particular light. And then there are other lights to determine the texture, the density and the thickness of the hair. So we are going to operate this device on this patient and we'll see how it looks. We'll start. So we do the initial preliminary details of the patient and then we start the analysis. So we have a set of clinical questions जो patient को answer करना होता है. उनकी hair loss के बारे में, उनकी scalp condition के बारे में, उनकी hair condition के बारे में, उनकी family में कोई history नहीं है, कोई diseases नहीं है, कोई stress pattern रहा है, इसके बारे में कुछ questions होते हैं जो patient answer करते हैं. ठीक है. वंस वी हैव टेकन द क्लिनिकल क्वेश्चन है, हम पिक्चर्स लेंगे पेशेंट की स्कैल्प की और आप देखोगे कि कैसे हर पिक्चर के लिए क्या जो डिवाइस है, जो कैमरा है, वो अपनी लाइट्स खुद सिलेक्ट करेगा. कौन सी लाइट में स्कैल्प बेहतर दिखती है, विच लाइट कैन शो द हेयर इन अ बेटर कंडीशन, इन अ मोर प्रिसाइज कंडीशन, जहाँ पे हमको कैलकुलेशंस करने में आसानी होगी. यू विल बी एबल टू सी इट. If you can see very closely, you can see that hair follicle opening तक हम clearly देख पा रहे हैं. And you can see कि कुछ hair follicle के openings बंद हो रखे हैं, किसी से healthy hair आ रहे हैं, किसी से hair पतले आ रहे हैं. So this is like getting magnified. अभी फिलहाल हम देख रहे हैं 50 times magnification में, इसके बाद हम देखेंगे 300 times magnification में भी. अभी जैसे सिस्टम हमको ऑटोमेटिकली इंडिकेट कर रहा है कि हमको हायर मैग्निफिकेशन में जाना है अगर हमने और प्रिसाइज कैलकुलेशंस करनी है. Now once we have captured all the images, as a doctor I have to do my 2-minute work where I'll be doing all the measurements. नॉर्मली हम हमारे हर एक स्ट्रैंड ऑफ हेयर की थिकनेस नहीं मेजर कर सकते हैं, पर जब हम उसको 300 गुना मैग्नीफाई करते हैं, दैट इज वेयर वी कैन सी कि 0.04 mm की थिकनेस है बालों की, जो हमको वहाँ पर एवरेज आ रही है. Now we'll measure the hair density, which is the count of hair in a particular area. And we'll be finally selecting the grade of the baldness. Now we've taken all the details, we've done our measurements, now we'll go ahead with the report. The system will analyze it, cross-reference through all the database of our patient and then show us the report. Now I would want you to pay the attention towards this report page, how it looks like. So on your left side you see all the images जो हमने लिए हुए हैं patient के for reference purposes. On the extreme right side हमको पूरा hair की condition की details मालूम पड़ती हैं, और center में हमको मालूम पड़ता है कि scalp की और hair की type क्या है, क्या normal है, dry है या oily है. अगर आप एक्सट्रीम राइट साइड पे देखो, सबसे पहले हमको मिला है ऑटोमेटेड हेयर लॉस स्कोर. दिस इज कम्प्लीटली एल्गोरिथम बेस्ड, दिस इज कम्प्लीटली एआई बेस्ड. पेशेंट की क्लिनिकल हिस्ट्री और पेशेंट की जो रिपोर्ट्स आई हैं उसके बेसिस पे हाउ द हेयर लॉस स्कोर लुक्स लाइक, देयर इज अ रेंज गिवन टू इट एंड द पेशेंट्स हेयर लॉस स्कोर इज कमिंग एज अ पुअर रेंज. सिमिलरली इफ यू सी, देयर इज अ थिकनेस ऑफ द हेयर विच रेंजेस फ्रॉम 0.04 mm to 0.2 mm, जो हेल्दी बाल कहलाता है. This particular patient, as we can see, he is anyways severely affected with baldness, तो इनकी जो density है वो बेहद thin आई है. Then we go to the hair count in a particular set of area, which is 12 mm square area. यहाँ पर भी हम देखते हैं कि there is a good range of the number of units that particular area can have, and that's also come on the lower side. So this is the analysis जो हमको count के हिसाब से मिलती है कि exactly where does the patient lie. जैसे हम कहते हैं कि बाल काउंट नहीं कर पाते हैं हम, so this is where exactly we can not only count the number of hair, we can count the thickness of each and every hair strand, which is also very difficult otherwise, and then basis all of this we can go to the treatment recommendation. So when we see here, the system has analyzed कि इस टाइप की अगर केस आती है जिनको ये कंसर्न्स हैं, इतनी थिनिंग है, इतनी बॉल्डिंग है, then what is the treatment that the system is referred through all the successfully treated cases and suggested. So basically we suggest a internal treatment of homeopathy, जो हमारी कोर है, जिससे हम जो अंदरूनी प्रॉब्लम्स होते हैं जिसके वजह से हेयर लॉस होती है उस चीज़ को ट्रीट करते हैं. Along with that we suggest home care measures, जैसे हमारे प्रोडक्ट्स जो हैं वो केमिकल फ्री प्रोडक्ट्स हैं, प्लस दे हैव इनबिल्ट होम्योपैथिक मेडिसिन एडेड टू इट, जिससे कि केमिकल डैमेज नहीं होता है हेयर को, एंड हेयर की जो क्लेंजिंग और न्यूट्रिशनल और मॉइस्चराइजिंग वैल्यू होती है वो बढ़ जाती है. एंड अपार्ट फ्रॉम दैट द सिस्टम इज रिकमेंडिंग अ गुड एस्थेटिक ट्रीटमेंट फॉर हेयर ग्रोथ, जो सारी इंटरनेशनल हेयर ग्रोथ ट्रीटमेंट्स होती है, और इसके भी हमने प्रोटोकॉल्स जो है वो AI बेस्ड करे हुए हैं, so that along with the hair growth there is nutrition, there is this hair booster treatment which is given along with it, जिसके कारण जो absorption serum की होती है वो बढ़ जाती है, एंड ये सारी प्रोसेस जो है वो पेशेंट को एक बेस्ट रिजल्ट्स की तरफ लेके जाती है. सो सिस्टम इज रिकमेंडिंग द बेस्ट पर्टिकुलर ट्रीटमेंट दैट कैन बी सजेस्टेड. नाउ इफ वी वांट टू डू अ कंपैरेटिव एनालिसिस, जैसे हमने इन पेशेंट की पहली बार ये रिपोर्ट करी है, बट इफ वी वांट टू सी हाउ इज ही प्रोग्रेसिंग विद द ट्रीटमेंट, जैसे 3 महीने बाद रिस्पॉन्स क्या है, 6 सेशन के बाद रिस्पॉन्स क्या है, तो we will be able to see session wise कि how is the scalp doing, how is each and every parameter of hair doing, whether we talk of density, thickness, hair loss score, क्या वो बेहतरी की तरफ जा रहा है. इससे जो है पेशेंट को बहुत एम्पावरमेंट मिलती है कि उसकी लाइन ऑफ ट्रीटमेंट में वी आर इन्वॉल्विंग द पेशेंट. दिस इज व्हाट वी थिंक यू आर रिस्पॉन्डिंग, this is what the report shows that you are responding, this is how your photographs look like, and then let's plan the next approach to the treatment. तो इतना scientific और इतना measurable आज तक hair नहीं था. Hair used to be always more dealt with the perception, at max with the photographs of the patient. We have tried to make it as scientific and as measurable as possible so that the patient has an exact idea how is he responding with the treatment. And apart from that, we also have this hair AI prediction model, जहाँ पर हम आपको ये दिखा सकते हैं कि अगर डिजीज की नेचुरल प्रोग्रेशन होती है, जैसे आप पर्टिकुलर स्टेज में आए हो एंड इफ द डिजीज इज अलाउड टू प्रोग्रेस नेचुरली विदाउट एनी ट्रीटमेंट इंटरवेंशन, देन व्हाट इज द पॉसिबिलिटी दैट वेयर इट कुड गो. So we have taken a sample of the patient picture. We've put her patient code here. It will refer to again the data that we have it inbuilt in our system, and then it will predict the possible progression of the disease. So as you can see that जो पहली पिक्चर है करंट स्टेटस के बारे में बात करती है. पेशेंट का फिलहाल ये स्टेटस है. अगर इस पेशेंट की अगर आगे कोई ट्रीटमेंट नहीं हो पाई या जैसे इसकी प्रोग्रेस चल रही है, तो जैसे लेडीज में होता है फ्रंटल थिनिंग बढ़ती जाती है, जो पार्टीशन हम करते हैं, जो मांग हम लेते हैं, उसकी विड्थ बढ़ती जाती है. सो दिस इज हाउ द पेशेंट इज एक्सपेक्टेड टू प्रोग्रेस इन अ पीरियड ऑफ 2 to 3 years. दिस इज व्हाट द प्रेडिक्टेड टूल कैन गाइड इट टू अस. इससे क्या होता है, पेशेंट को डिसीजन मेकिंग में हेल्प होता है कि कितने जल्दी ट्रीटमेंट के लिए इंटरवेन कर सकते हैं. एंड एज डॉक्टर्स वी ऑलवेज सजेस्ट our patients that the earlier you intervene and you take a treatment, better are the results, shorter is the treatment duration, और जो हम modality use करते हैं वो भी हमको कम रखनी पड़ती है. As the grade increases, the modality of treatment also intensifies. So this is where it helps us. That's about it. Thank you.
Dr. Vaishal, live demo. Any questions? You can take maybe 2-3 questions now, otherwise we can, yes, please.
You've shown that